Thank you, Dr. Tan, for the introduction. My name is Elaine. I'll go through with you the tips and tricks in managing heart failure. So in summary, what is heart failure? Dr. Chai and Dr. Hong has really gone through that part. So heart failure basically occurs when the heart muscles does not pump as well as it should be because the muscles are too weak or too stiff. As a result, fluid build up in various parts of the body, such as the legs, the stomach, the lungs, etc. And this leads to symptoms such as shortness of breath, swelling in the legs or the abdomen, as well as feeling fatigue. But with medication and lifestyle modification, heart failure can be well managed so that you can continue to lead a very good quality of life. So what are the lifestyle changes that you need to do? And these are some of the examples. For example, take your medicine regularly, change your diet, restrict your water intake, keeping active, stop smoking, monitoring your weight and symptoms, and knowing when to seek for early medical attention. I'll go through the first point first, taking your medication regularly. Now, heart failure medications, as mentioned by Dr. Hong, can help to prolong your survival, reduce the risk of heart failure rehospitalization, reduce the workload of the heart, improve symptoms, as well as improve your quality of life. Now, these medicines are usually started at low dose and then slowly up titrated to a higher dose whenever you visit the clinic. Why we need to do this is because this heart failure medicine works better at a higher dose, as mentioned by Dr. Hong, because it will give you a better outcome. Apart from taking your heart failure medications regularly, it is also important to take your other medications such as your diabetes medicine or cholesterol medicines in order to keep your chronic disease under well controlled. There are different ways to remember to take your medicine. So one of the common ways that we advise our patient is through the use of pill boxes. Another way is to stick your medicine chart on a medicine cupboard so that you can use it as a reference. Take your medication at the same time every single day so that it develops a habit. Set alarm on your handphone to remind yourself to take your medicine. If you use our Health Buddy app, there is this function called the medicine reminder, so you can set your alarm there. If taking medicine is very expensive, cost is an issue, please do let your doctor know. We can refer you to the social worker where we can help to obtain some medicine funding. If you feel unwell after taking or adjusting the medicine, also please let us know that you don't feel so well and do not stop taking medicine on your own without doctor's advice. This is the Health Buddy app where you can set medicine reminder. Now, sometimes after taking the medication, you do feel a bit of giddiness because the medicine can lower your blood pressure slightly. So what you can do is that you can avoid sudden postural change to reduce this postural giddiness. So whenever you change your position, do it slowly and in stages. Sit on the edge of the bed for a few minutes before standing. If you still feel giddy after changing position, please sit back down. You can do simple lower limb exercises such as moving your ankles up and down before and after changing position. Avoid bending down to pick up things. Avoid taking large meals. Avoid hot baths or showers. If possible, try to sit down to shower or wash or get dressed. Making sure that you do drink enough water as prescribed by the doctor, but do not drink excessively. The other point is low salt diet. Now I'll go through that. Now, apart from eating healthy, it is important for our heart failure patient to reduce their salt intake because salt itself can cause or worsen water retention. Therefore, it is important to limit the use of salt, soy sauce, and other salt condiments in your food. Here are some tips some easy ways for you to cut down or reduce sodium in your food. So instead of adding salt to your food, you can use natural herbs and spices to substitute salt. You can choose fresh food, vegetables, etc. Instead of using processed and preserved food. When eating out, reduce the intake of soup or gravy. Learn how to read food labels. Choose food with lower sodium content. The total daily sodium intake should not exceed 2000 mg. If you are in doubts or not sure what to do, you can consult a dietitian to help you with your meal planning. Next, I'll move on to water restriction. As what Dr. Hall mentioned, we do not encourage our patient to drink excessively. Why? Because it will cause a lot of water retention when your heart function is not so good. So limit the fluid intake to the amount prescribed by the doctor. Usually it's about 1.2 to 1.5 liters. But also do not drink too little to prevent dehydration, but do not drink liberally. Include all beverages and fluid into the water restriction, and keep track of how much you drink on an everyday basis. You can either pre-measure them in a pitcher, in a bottle, or you can measure them in cups. Avoid alcohol intake. When you drink lesser fluid, you may feel more thirsty than usual. So instead of drinking more water, what you can do is that you can gargle your mouth, or you can make some ice chips and suck on ice chips on very hot weathers. You can nibble on some fruits, but if you have diabetes, be careful of your fruits intake also. Suck on sugar-free mint that will help to keep your mouth fresh. And if your lips are very dry, you can use lip balm or moisturizer. Next, I'll move on to keeping active. Now, exercises can help to improve your symptoms, improve your stamina, your muscle tone, as well as your general well-being. So we actually encourage our heart failure patient to do some form of exercises. So you can start gradually, begin with short manageable activities and increase over time. Walking is the safest mode of exercise, and it can help to improve your stamina and symptoms. You can start off with a comfortable pace as tolerated. Always monitor for symptoms such as chest discomfort, dizziness, severe breathlessness when exercising. Avoid vigorous exercise and carry heavy weights. When in doubt, consult your doctor or physiotherapist. Next, I'll talk about stop smoking. Smoking leads to narrowing of your arteries in the heart as well as other parts of the body, resulting in reduced blood and blood oxygen supplying to your heart muscle. So when your heart function is weak, when this happens, it will worsen your heart function even further. So smoking is also put you at risk of developing blood clots and stroke. Next, I'll talk about monitoring of weight and symptoms. As heart failure patient, one of the ways to monitor yourself is to monitor your body weight. Why we suggest this method is because water weight is heavy. If you have sudden weight gain, it is most likely water retention. So what you can do is that you can get a weighing scale to check your weight on a daily basis. The best time to weigh yourself is in the morning, after you wake up, after you pass urine, and before your breakfast. Record your weight in kilogram into a daily weight diary. If you notice a sudden weight gain of 2 to 3 kg within a short period of time of 2 to 3 days, it is likely water retention. For every 1 kg increment is about 1 liter of additional fluid in your body. So you monitor for other symptoms such as fluid retention, such as worsening of lower legs, ankles, and abdomen, or you have increased shortness of breath, especially at night when you lie down to sleep, or even at rest, when you have loss of appetite with stomach bloatedness. Last, I'll talk about knowing when to seek early medical attention. So when you feel unwell, you should see a doctor early. So when do you make a call back to heart center to see your doctor? When you have a sudden weight gain of 2 to 3 kg within a few days, when you have increased swelling of legs, ankles, or abdomen, when you have increased shortness of breath, and especially at night when you're lying flat or even at rest, when you have loss of appetite with bloatedness, when you feel constantly dizzy and palpitation, or you have worsening cough. Any other conditions like cough, cold, runny nose, you can go to your GP or your polyclinic. If you feel very unwell, please proceed to the nearest A&E for immediate medical attention, or if you cannot manage, please call ambulance 995. So in summary, in order to reduce the chance of developing heart failure or heart failure episodes, it is important to lead a healthy lifestyle through regular exercise, healthy diet, taking your medicines regularly, and managing your other chronic conditions well. And so with that, thank you.